All right. Well, welcome back, everyone, to Spooky Drugs Day 3. We have 14 whole days of this, so you're in for lots of scares for the month. So, maybe we should make a Halloween costume where I'm just covered with pills and capsules and drugs and skulls and crossbones and stuff. I don't know. I don't think I'm dressing up for Halloween, but if I was, maybe that would be a good thing for this year. So I want to talk about Trilostane, also known as Vetoryl, and then I'm going to touch on mitotane, also known as Lysidrin. What we're talking about today is drugs that are used to treat Cushing's disease in dogs. We really don't see Cushing's disease in cats. There may have been one or two reports in the literature, but this is really kind of a dog thing. And 80 to 85% of Cushing's disease dogs, the disease is caused from a tumor in the pituitary gland, which is at the base of the brain. But the pituitary gland tells the adrenal glands to make the hormones that it makes for our survival. The other 15 to 20% of the cases of Cushing's disease actually come from a tumor of the adrenal gland. So if the diagnosis is a tumor of the adrenal gland, which you would diagnose by doing an ultrasound and seeing what it looks like, I only ever had one case of an actual adrenal gland tumor, and the owner was willing to have surgery to have it removed, but it was not operable. And most of the adrenal gland tumors are not operable because they lie too close to some major blood vessels that make the surgery extremely difficult. So it should only be attempted by a board certified surgeon who is familiar with the surgery. And that is really the only way you are ever going to get a true cure from the disease using traditional therapies. Surgery on the pituitary gland is starting to be performed, but it's pretty rare. There's only a couple places that do it. I think there's a university or two that are now starting to do that. Your dog is on Vetoryl. Well, then this is very important for you. So in a large adrenal gland based on ultrasound, when you get that, then you want to go in and do the adrenal gland testing. And I have, hopefully somebody from my team will start to post these things, but we have a download or a blog or an infographic, something on the website that talks about how to diagnose the best ways to diagnose Cushing's disease and also alternative treatments for this disease. Because by the time I'm done talking about these chemicals today, you are going to say, there we go. Thank you very much. The guide to Cushing's disease. You are going to say, holy cow, I need to run as fast as I can away from this drug. So I'm going to talk real quickly. The drug that when I graduated from school, we did not have Trilostane. We had mitotane, which is also known as Lysidrin. It is not approved for use in dogs. It destroys the adrenal gland layers that produce cortisol. And it actually is a chemical that comes from DDT. Everybody remember DDT? What was that book back in the, I can't remember the name of the book. I had to read it in high school. Rachel Carson, I think, wrote it. Anyway, about killing our world with DDT and that sort of thing. It's an insecticide. So mitotane, rarely used. Some old school veterinarians are probably still using it. Not recommended at all. So the newer drug, Trilostane, was approved for use in dogs in 2008. You're going to love this next thing, though. The FDA did approve it for both adrenal gland tumor and pituitary-dependent hyperadrenocorticism, so basically a tumor of the pituitary gland. This drug was originally used in humans, but it was taken off the market in 1994 due to too many reports of sudden death. People were dropping dead taking this drug. So in 1994, they said, we're getting rid of it. But in 2008, they said, hey, we have a new use for this drug. We're going to use it in dogs because if they drop dead, people can only sue us for, a couple $100. We'll give them $500, tell them to go away. It'll be no problem. Great. So let me run through. There's so much stuff. Here's my piece of paper with all my rambling and notes on it. So, I'm trying to make sense out of it. side effects that are listed on the label: vomiting, diarrhea, anorexia, lethargy, depression, weakness, allergic reaction, collapse, tremors, seizures, and neurologic signs, hypoadrenal crisis, because what this is doing is it is stopping production of the hormones by killing off layers of the adrenal gland. So it stops it from making cortisol, stops it from making aldosterone and all the other related hormones that the adrenal gland is responsible for producing. So it's not curing the disease, it's basically shutting down the adrenal glands. Well, you know what? The adrenal glands have very important functions in the body. So the goal is that we kill off just enough that it's now putting out normal amounts of the hormones and not too much that we shut it down. But it's a really fine line between enough and dead. So hypoadrenal crisis, where we basically take the dog and make them into an Addisonian. So now they have Addison's disease, which is the opposite of Cushing's disease. It's no adrenal gland function. Not a good place to be, because then you're going to have to replace with synthetic hormones what you just destroyed that the body was producing. Okay. So that's hypoadrenal crisis, and the symptoms of that: vomiting, diarrhea, bloody diarrhea, kidney failure, and death. So death, that's kind of a biggie. You know, most of these drugs that we talk about, we're going to talk about death. We don't like that outcome. Increased liver enzymes, very common with the drug, and increased BUN, very common with the drug. We can get adrenal gland necrosis, which is complete death of the adrenal gland, or adrenal gland rupture from the drug. Let's see, should not be given if the dog has kidney or liver disease. Well, many of these dogs are older dogs that also have almost all of them have abnormal liver enzymes because they have a swollen liver secondary to the disease. So how do we define that the dog actually has liver disease or the dog has increased enzymes in a swollen liver from the Cushing's disease? So you got to be really clear on whether they actually have liver disease. And if they have decreased kidney function, they can't be on this drug either. And they cannot take this drug if they are on medications to treat heart disease. Again, we're talking about a lot of senior dogs. So it can't be given if they are on enalapril, benazepril, spironolactone, or potassium supplements. So for anybody who is using this drug, if your dog gets diagnosed with heart disease, something's got to give, because you can't use these drugs along with the Trilostane. Also cannot be used with ketoconazole, which is an antifungal. And you certainly don't want to use it along with mitotane, which is Lysidrin, which is the other drug that kills the adrenal gland. And if you have your dog on one of these drugs and want to switch to the other drug, you have to have at least a 1 month period in between. So if you say, oh, mitotane, too many side effects, don't want to do that, I want to switch over to Trilostane because it's FDA approved, which doesn't mean squat here. Then you've got to have a month in between, and you got to do a lot of adrenal gland testing. Cannot be used in dogs that are pregnant or males intended for breeding. You shouldn't be breeding a male who has Cushing's disease anyway. And ketoconazole has actually been used in place of Trilostane or Lysidrin. I don't think it's used very commonly anymore. If you're using this drug, you absolutely have to monitor lab work, and it's a lot of lab work. So you've got to monitor the electrolytes. You want to know what your sodium potassium ratio is, because that's going to give you a clue as to whether your dog is getting too much of the adrenal gland killed off. You also need to do ACTH stims, which are ACTH is the adrenal gland hormone produced by the pituitary gland. So you want to give that, stimulate the adrenal, and see if it's able to respond. If it has zero response, then you've killed off too much of the adrenal gland. So it's a fine line. I recommend repeating this labs every 3 months. It gets really expensive because it's a fine line between we killed off just enough and we killed it all off. So you've got to be monitoring that at least every 3 months with that ACTH stim. On the label, it says, wash your hands. After handling the pills, don't handle their capsules. Don't handle if pregnant or if you're trying to conceive. Do not open the capsules and split doses. So anything where they tell me, wear gloves, wash your hands, don't get it on your skin. I'm like, ooh, and I'm feeding this to my dog? No. You currently have your third Cushing's dog. You feel like you're doing something wrong. Well, let's look at the diet for sure. I started to write a book on Cushing's disease, and I got about 75 pages in and then switched over to another project. So it's still sitting in my computer from 2 years ago. So a U.S. field study was done on Trilostane. This you're really going to love, folks. 107 dogs. 4 had to be removed from the study. So for various things, but of 107 dogs, we got rid of 4. So we're down to 103. So this is good. So we're just going to round it off to an even 100 because that gives us 100%. 97 of those dogs had adverse reactions and 5 died. So 5% of the dogs given the drug died. 97% of the dogs had an adverse reaction. And here's what they were. 2 had adrenal necrosis or rupture. 2 developed outright Addison's disease within a week. So those 4 were in the first week of the drug being given. 31 had diarrhea, 30 had lethargy, 27 anorexia, 28 vomiting, 25 had worsening lameness and degenerative joint disease. I find that to be very interesting. 17 had UTIs and hematuria. Oh, and by the way, another side effect is incontinence. I don't know if I mentioned that one. 10 had shaking and shivering, 8 had ear infections, 8 had skin infections, and 7 had respiratory infections. Oh, and by the way, it can also cause heart murmurs and cardiovascular disease. I don't know. So far, I'm kind of loving this drug. How about all you guys? Like, this is scary stuff. Now, your traditional veterinarian has this. This is what they have, this drug, to treat your dog. Alternative veterinarians or holistic veterinarians, integrative veterinarians, whatever we're going to call us, do it differently. I can think of 2 dogs in my practice in the last 15 years that were on this drug. One of them was not put on it by me. The other one was put on it by me because we couldn't get the dog to respond to anything else. We monitored very closely and the dog did fine. But very good pet parents who were willing to do the monitoring all the time. So we do in the guide to Cushing's disease, which Gwen put in the comments and pinned it at the top. We tell you some of the natural ways to help deal with this. So things that can be used: flaxseed lignans. The doses are in that download. Flaxseed lignans, melatonin, because they help stop the binding of some of these hormones so that we're not getting that excess effect on the body. We use Chinese herbs, and we use food therapy. And so there are so many things that can be done. And what I found with personal experience is that 98%, 99% of the dogs that I treated, well, higher than that because I treated more than 100 Cushing's dogs, they did fine without having to resort to the drugs. And I'm not a homeopath, so I don't even use homeopathics in my practice. And I'm sure if we talk to a homeopath like Julian Lee or Maria Ringo, we could probably find or Di Blanco, we probably could find a lot of homeopathic remedies that also could help with this condition. So this is, your dog 11 just diagnosed, came out of nowhere, blood work fine last year, 0 indication. Does it come on that fast? Well, it's been simmering. It's just that you just discovered it now, but it's been simmering. It's not something that it comes on, overnight. It's a slowly building process, and this comes on our animals. So we have things like glyphosate that are in the food chain. Glyphosate is what's sprayed on the crops, and glyphosate. We find it in urine and blood levels in a very high percentage of people, a very high percentage of our animals if we test for it. Glyphosate is an endocrine disruptor. So it is screwing with our endocrine glands: thyroid, pituitary, thalamus, hypothalamus, adrenal glands, ovaries, testes. So when we have these endocrine disruptors constantly bombarding our bodies, we get these kinds of problems. So if you are feeding dry kibble that is is causing, or, is filled with grains or field crops that have been sprayed, you're going to have higher levels of glyphosate. There was a Susan Thixton probably has on her Truth About Pet Food site, if you went on there and put in glyphosate, and I think she has some measurements from different pet foods. There was a legal group. I haven't seen anything from them recently, but for a few years ago, they were testing and bringing lawsuits against pet food companies for levels of heavy metals, levels of glyphosate, levels of toxins that they tested, and they were privately testing and finding in the foods. And then they were actually bringing lawsuits. I know they brought one against the wellness people because on their, and I think they brought one against Blue Buffalo too, but on their bags, they talk about, better health and, high quality ingredients and no toxins, blah, blah, blah. And then when they tested the food, they found all these toxins and said, well, that's false advertising. So they were sued for that. I don't know how it all ended up. I would have to go back and find all that. I remember talking about it a lot when we were still in New Jersey. So it would have been around 2019, 2020. So yes, this is straight up poison. And what it's doing is killing the adrenal gland off. It is not curing anything. Not curing anything. It's decreasing symptoms because it's decreasing the amount of hormone being released into the bloodstream, but it's not curing. So I did want to put a reminder out there before I sign off today. Get signed up for the Pet Nutrition Summit that is coming up the first weekend in November. There should be a link on our page, or Gwen's going to put it back in here about 5 more times. Sign up using our link, and we have some amazing, amazing experts on this summit. I know there's been a lot of summit information. We just had the Raw Summit. Dr. Katie had done the Gut Health Summit maybe a year or so ago. But there's been a lot of summit information coming out. But I have to tell you, we got to choose who we wanted on this Pet Nutrition Summit, and we have amazing people: Dr. Connor Brady, Dr. Nick Thompson, Dr. Barbara Royal, Kathy Alanovi. I'm going to leave people out: Kimberly Gutierrez. So we've got a lot of good people in this summit. Ian Billinghurst, Matthew Muir from Australia. A lot of amazing speakers, amazing information. I actually learned a lot doing the interviews, so it was really, really, really fun for me. All right, you have a dog on Vetoryl every other day and Xiao Chai Hutang, an Adrena boost, getting blood work done in 3 weeks. What are you looking for? Trying to get her off the Vetoryl, feeding Dr. Harvey's. Does this have anything to do with getting laparoscopic spay a year ago? Probably not. And I'm glad that you've done something good with the diet. I'm hoping your Dr. Harvey's is either Paradigm or Raw Vibrance, and not the one with the grains. And obviously you're working with a TCVM doc to have the herbs on board. And what you're looking for is stabilization of the labs. And hopefully you're also checking the ACTH stem. And my goal would be to keep decreasing that Vetoryl, hopefully, and get to the lowest dose possible, or none at all would be amazing. You give your dog HMR, lignans, melatonin, and milk thistle. Perfect. Dog's on the lowest dose there is, 5 milligrams. Yes, but what is that per pound of body weight? Feed raw natural supplements. Has your boy on Trilostane, but I don't want him on it. Yeah, I would do everything I could. Work with a TCVM or an herbalist, Rita Hogan. Somebody that can help you work through that. Your dog has Cushing's and proteinuria. Well, sure, they have proteinuria because the Cushing's raises the blood pressure, and that causes protein leakage. Had her on Trilostane and enalapril. She's since been taken off enalapril and a lower Trilostane dose after seeking a third opinion. Yeah, keep working on that. You got to really get that dose down and make sure you are doing the ACTH stems, monitoring those adrenal glands. You do not want to end up with adrenal necrosis or Addisonian crisis. No, do not just stop it. If you have a dog on it, you are going to have to work with your vet and do a tapering. And while you're doing that tapering, you are also going to have to fix the diet, get some herbal support, get some other supplements on board. So your dog is on lignans and melatonin over a month. Will it skew the results of the ACT? No, won't skew it. I mean, it might make it look better, but that's fine. Because if you get normal results back, that's great. Keep going. Will milk thistle protocol help with detox of glyphosate? I have a blog somewhere way back on glyphosate. If you go to the website and put it in, and I don't know if I did a detox protocol in there for that or not. I do know that Dr. Kendra Pope, she's our TCVM oncologist up in New Jersey that we love dearly, recommends detoxing your dogs at least a couple times a year, liver and kidney detox in general. Humic and fulvic acids were recommended on a recent pet longevity summit to offset the effects of glyphosate. I think that would be great. Absolutely. So, all right, holistic mast symptoms, but calcinosis cutis developed. Yeah, so calcinosis cutis is the really advanced Cushing's disease, and that's where they make these huge calcium deposits up along the back. I only ever saw that once. I saw one case in a Cavalier in my whole career. So paradigm, good. Okay. All right. Shared this. Everybody knows somebody with a dog with this because it's so common. It is so common. The interviews were done. They're taped, but there will be live interaction every day. There will be on the Pet Summit page there. I will be live every day. I think starting before and then going through the summit to answer questions about what was on that day and the interviews and that sort of thing. No, it is not something that's contagious from one dog to another. Yesterday, dog with nasal carcinoma placed on piroxicam. Yeah, I mean, they definitely use metronomic therapy with non-steroidals for cancers. As long as the dog's stomach can handle it, go for it. Your dog was just diagnosed with Cushing's. Okay. Should ACTH stem need to be sent to University of Tennessee as well? I know the load. I sent all of my adrenal gland testing to University of Tennessee lab. I just like them the best. I think they do the best job. I think they have a really good handle on it. We've been posting things about Antec Lab being owned by Mars. And I like sending it to the experts. And I think that University of Tennessee Veterinary School Endocrinology Lab is the best one for this. So, there it is. Glyphosate. What is it and why should I care? There you go. Thank you, Gwen. What's the best way to get an accurate blood pressure? There's actually more invasive ways to do it, but really with, everybody just uses a cuff. It'll work. But you want to do it when the dog is calm. So if you're having it done at the veterinary office, you want to do it when they first go in before they get poked and prodded and all worked up. I think it should be done with the owner right there so that they feel calm and stay calm. Because it can, it can easily go up. That white coat syndrome when they're afraid of doctors and everybody who's touching them. How long should you keep a pet on milk thistle for detox? I don't know that there's a specific limit, and it kind of depends on what you're doing. I mean, if you've got elevated liver enzymes, you may want to continue using it. Rita Hogan had some really interesting thoughts on milk thistle, and she likes to use what she called milk thistle stem cell. So she was talking about that on an interview that I was part of last night. So you might want to look up Rita Hogan. She's an herbalist. Okay. Ion Biome from Zach Bush for glyphosate detox. Great. How can you tell if it's working? I don't know that you can. Because unfortunately, we're all walking around with it in our bodies and we don't realize the side effects of it. So your vet said that natural will not help Cushing's. He supports natural, but not in this instance. Well, that's quite interesting because that's how I treated all of them. So yeah, this is, we'll stay on our Facebook page. So you'll be able to, have I heard of using DMSO for arthritis? Yeah, we used to use it in horses all the time. You will absorb it through your skin and it tastes terrible. I can taste it right now thinking about it. Ugh. Can we send there ourselves, or the vet needs to send to Tennessee? The vet needs to. They just need to set up a, it's very easy. You can go to, maybe we can get it typed in here, but you can go to the University of Tennessee Endocrinology Lab website, and it has the forms there with the prices right on there. You can all see them. And it's very easy for your vet to set up an account with them. And it has directions for how to do the tests. It has directions for where to send it. It has directions for how to ship it. Really very simple. So very easy to follow website. One dog with Addison's and one with Cushing's. Oh my goodness. Well, Addison's, I think, is more congenital overall. I don't really feel like Cushing's is a congenital issue. Is there a blood pressure cuff you can buy for home? You can use human ones on big dogs. If you have, a big dog with a big forearm, if you go on YouTube and look, there is a YouTube video of a woman taking her dog's blood pressure. It's like a Doberman. It's a bigger dog. Okay. So instead of using the Proxicam, yes, we have herbal supplements, but the reason for the Proxicam is it actually has cancer fighting ability. It's not just being used for inflammation. So certainly you could switch to herbs, mushrooms, more natural things that also have cancer fighting ability. So that's up to you. Yeah, I would find somebody to work with. I don't know where you live, Donna, but if you're in the New Jersey, Pennsylvania, southeastern New York area, try to get a hold of Kendra Pope. I don't know if she does online consultations, but she's pretty amazing. Your dog had Cushing's. Trilostane really helped. He's 13 pounds, 5 milligrams twice a day, in horrible shape before he started. 8 paradigm rotated proteins. Great. And he also had hypothyroid disease. So that's really common. So you don't usually get one endocrine disease, you get multiples. Is DMSO safe for Cushing's? I haven't looked at using DMSO for Cushing's, and I never used DMSO for dogs except in the little cyanotic drops. So I can't really speak to that. Yeah, I mean, the couple of dogs that I had to put on Trilostane did okay with it, but it's a matter of really monitoring and going in with your eyes open and knowing that these are the problems that could occur. And if they're not diagnosed until really far in the disease, you may not be able to catch up using alternative therapies. It's the earlier you catch it and start working at it, the better you do. Okay. DMSO goes with vodka. How soon after TPLO can you see arthritic changes? Well, it depends how long they had the cruciate tear before the surgery, but literally within months. Okay, please finish my Cushing's book. I'm going to dig it out of my computer. Oh, that might be in my dead computer. I may or may not be able to get it. Okay. Somebody said they have a veterinary animal blood pressure machine that they got on Amazon for their small dogs. There you go. Right there. It's on Amazon. Okay. All right. Okay. That's it for today. I used up a half hour of our time. I will be on the Spodcast, SPAWD cast tonight with Carrie Hyde from the spa in California at 7 p.m. Eastern, 4 p.m. Pacific. So if anybody feels like tuning into that, we will be live tonight at 7. I think her topic is Vets I Trust. So this will be, I think, my third time on that show. So if you have questions and stuff, you can hop on to that later this evening.